Thanks very much, Anya. So I'd just like to take a minute to say thank you to the Companion Animals New Zealand organising committee for inviting me to speak today. This is a subject that I am very passionate about. It's also a subject that I think we don't talk enough about. And I think having these conversations around death is actually a really important part of managing animal welfare. It's a really important responsibility that we have as veterinary surgeons. And it's something that I think professionally, in a strange way, we can take a lot of professional pride in. So without further ado, I'll just give a brief overview of my presentation. I'll be covering some brief definitions to start with around moral stress, animal welfare, ethics and euthanasia, and exploring the welfare and ethical issues that may influence the decision making around euthanasia, and then just finishing up with a couple of practical tips and some resources. And I'd be really interested after the presentation in hearing any tips or tricks that anyone else has, because I'm always very keen to improve my patients' experiences of euthanasia. So moral stress is one of the big challenges that we as veterinary surgeons face, and it arises from the tension between what we feel we ought to be doing, or the ideal of our profession, and the reality. And when those two things don't align, then that can be really stressful for us, and that's a big source of discomfort in the veterinary profession. Other things that we need to think about in terms of definitions are ethics, because they influence what we think we ought to be doing, how we decide whether our actions are right or wrong. And applied animal ethics are a branch of moral philosophy. And then also we need to think about what we mean by the term animal welfare. And there is no universal definition of animal welfare, but it's broadly understood to be a scientific concept that describes how an animal feels at a particular moment in time, and that covers its physical, emotional, and behavioural well-being. So what kind of things influence euthanasia decision-making, and why is it such a source of moral stress? What are all the factors that mean that it's such a stressful decision for owners, for vets, and for anyone involved in making that decision? One of the things that influences is the status quo bias. As humans, we really like things to stay how they are. We don't like change. We don't like a deviation from the norm. We don't really like making difficult decisions. And I know you're going to hear from Rowena later, and she's the expert in this area, really. But we see a lot of this around our companion animals, this sort of normalization of pathology, particularly when that pathology is gradual or it evolves over time. So, for example, if we look at this pug puppy, this was one of my cases that was presented to me, we can see that there's fairly extreme conformation there, and this puppy was really sick. But do we think about euthanizing that puppy and stopping that life at that early point to prevent that potential lifetime of suffering associated with brachycephaly? If we have a pug whose airway is so obstructed when she goes for her bitch spay at the age of 6 months or a year old, and she needs her endotracheal tubes to be kept in whilst she is recovering from surgery because she's breathless, then is that the point at which we might consider that she's suffering and think about euthanasia decision making, or is that just normal for the breed? And what about the older brachycephalic dog that's lost its muscle tone and is obese and has excess body fat and is actually unable to breathe during surgery, and we can't intubate, and we have to go to a tracheostomy? Is that the dog that we think perhaps now's the time to euthanize this dog, or is that just normal for the breed? And making decisions around animal suffering is really challenging when it's a progressive pathology, or when those pathologies are normalized. We're much better at making decisions where there is a sudden and abrupt decline, and it's an obvious decline in that animal's welfare. So that's one of the challenges around euthanasia decision making, is really being able to critically evaluate and objectively evaluate the impact of a particular problem on that animal's welfare. There's also conceptual confusion regarding uses of the term euthanasia, and I'm going to come on and talk about that in just a second. And then personal and professional motivations also influence our decision making, as do training and drug access, and I'll also touch upon those things. So in terms of conceptual confusion, when euthanasia itself literally is translated from the Greek, it means a good death. And back in the 90s, Professor John Webster suggested that because of this, death itself is not a welfare problem. And if we consider welfare to be a spectrum where animals at one end of it might have really poor welfare and be experiencing suffering, and animals at the other end of it might have really good welfare where all of their needs are met, then we would generally consider death or euthanasia to be neutral. Animals can't experience anything when they're dead, so they're not suffering, they're not experiencing poor welfare, they're also not experiencing good welfare. So death in itself, we might consider it to not be a welfare problem. And if we use the analogy of anesthesia as a similar experience to euthanasia, then actually we can see that there are some similarities from a welfare point of view. In fact, if we think about a healthy animal going for anesthesia, it's probably hungry and it's probably separated from its owner. Whereas an animal that might be going for euthanasia, even though it's healthy, is probably not hungry, or at least you have the option to feed it, and its owner might choose to stay with it. The induction experience is broadly similar. The animal experiences rapid unconsciousness. The only difference is that one of those animals, the surgical animal, is recovered, potentially experiencing dysphoria and discomfort, whereas the animal that's euthanized is not. So broadly speaking, we could argue that the animal's welfare experiences are the same and that death, therefore, is not a welfare problem. We don't have the same moral conflict over anesthesia as we do with euthanasia. But if we all thought that, then I probably wouldn't be delivering this presentation. And of course, there's a spectrum of views around the acceptability and the ethical justification for euthanasia. James Yates suggests that it would be unrealistically pessimistic to think that the euthanasia to prevent the suffering, that it would be unrealistically pessimistic to think that the prevention of suffering legitimizes the killing of any animal. And that just because an animal may suffer at some point in the future, that doesn't always justify its euthanasia. We have to weigh up that decision and ask if it's in the animal's interests. So when we're making decisions about euthanasia, there are a range of different viewpoints, from people who believe that euthanasia is killing painlessly for whatever reason, and that we shouldn't get bogged down in the moral or ethical justification for it, that it's killing painlessly when that killing is in the animal's interests, and that's quite often associated with how we apply euthanasia to humans as well. It's mercy killing or killing to end suffering. Or we might broaden that definition even further and suggest that it's killing painlessly in the animal's interests or in the interests of the owner or the wider society. So there are a whole range of different viewpoints around how we define euthanasia, and it's really important that we understand that other people may not interpret the term euthanasia in the way that we do, because that misunderstanding, that talking at cross purposes, can create conflicts, and it can create challenges when we're trying to make decisions around euthanasia. So we have to understand what the people mean by the term euthanasia and what their level of moral, ethical comfort is in terms of making that decision and the justification for making that decision. So an example where that often creates moral challenge is convenience euthanasia, a situation where an owner decides that an animal is no longer wanted and chooses to euthanize it. And in a recent survey of just over 1,000 veterinary professionals in 73 countries, convenience euthanasia was considered by about half of the respondents to be an important or very important animal welfare problem. So they consider this to be a welfare problem. They're not sitting in that group of people who thinks that killing, as long as it's done painlessly and humanely, is not a problem. They think that convenience euthanasia is a welfare problem. It's considered to be less of a welfare problem than delayed euthanasia, but it is considered to be a welfare problem by approximately half of the vets that responded. So other things that influence our decision-making around euthanasia are our personal and professional motivations. Most vets and animal owners and caregivers want to help or heal their animals. And this can make proactive euthanasia decision-making morally stressful, because there's always that what if the animal gets better? What if the animal can have a good life? What if I've made this decision too early? But from the animal's experience, again, there's no real difference in that euthanasia experience, whether that's taken for health reasons or for convenience reasons, actually, except that the animal euthanized for health reasons is usually already suffering. And actually, you could therefore argue that its welfare experience is worse before we make that decision. We're waiting for it to suffer before we do anything about it. And that can be a source of moral stress as well. There are also social and peer pressures around performing euthanasia for some people, and particularly if we look at different countries and cultures. There can be a reputational risk to performing euthanasia. There might be a perception that you've given up too soon, that you didn't try hard enough, that trying anything is better than nothing. And if you can see the images on the right-hand side of my screen, these are examples of animals where the vets thought that trying something was better than trying nothing. And those animals suffered quite a lot, I would say, because of that veterinary intervention, and would potentially have been better off without it. So we know that delayed euthanasia is considered to be an important source of welfare concern for cats, dogs and horses in the UK. But what about on an international scale, on a global scale? Well, the survey that I mentioned before also looked at delay or refusal to euthanize amongst the welfare issues that it investigated. And interestingly, delay or refusal to euthanize was one of 4 welfare issues where there were no regional differences. So on all of the other welfare issues we looked at, there were regional differences, but in refusal or delay of euthanasia, there wasn't any regional difference. So it does appear to be something that's of universal concern amongst the veterinary profession. Now, the reasons why people might delay to euthanasia or refuse to euthanize, we haven't fully explored. And I think that that's an area that we need to do more work on in order to ensure animal welfare is maintained and that animals do have a good life and a good death. So the last thing I wanted to touch upon in terms of some of the considerations around euthanasia decision making are training and drug access. And in the work that I've done, I've seen a lot that there are often assumptions around why people might not euthanize animals. And often those barriers are assumed to be cultural or religious or community-based. And absolutely, those things can be a challenge. But I think the thing that we often overlook is that some of the barriers are actually just training, knowledge and skills. In many countries around the world, vets are not actually trained in appropriate euthanasia techniques. And in a piece of research that we did just a couple of years ago, we looked at training of Indian veterinarians in euthanasia techniques, and we did pre and post knowledge and attitude assessments of those vets. And in the pre-training questionnaire, only 25% of the vets scored 1 or more marks out of 4 when asked to describe methods of euthanasia. So that showed a really significant knowledge gap. They just didn't have that training and that understanding about how to perform euthanasia. And euthanasia drug access can be a challenge in a number of countries as well. The WSAVA have produced a list of essential drugs, essential medicines, and I think it's really important that as vets, we campaign to ensure appropriate drug access for humane euthanasia. So euthanasia is a complex skill, and training is required, not just in the technical aspects of drug selection, IV access, et cetera, et cetera. We also need to think about the animal's comfort, making sure that that experience is as good for that animal as it can be, that we've provided analgesia, that we're using low stress handling techniques, that the animal's in a positive emotional state. I always like to feed my patients whilst I'm putting them to sleep, just before and whilst it's happening, because I want them to go out with a really nice experience. So I always give them something delicious. It's really important that we communicate with clients, ensure that they're clear on the process beforehand and that they're aware of any challenges that might arise, and also that we're comfortable in managing their experience through that euthanasia process and afterwards into that bereavement. There's often large feelings of guilt and grief associated with making that euthanasia decision. So it's not just about the process of euthanasia, it's also about that wider consideration of the context of the euthanasia, and general animal welfare is important. And I'd just like to signpost you to the WSAVA Animal Welfare Guidelines. They're free to download from the WSAVA website. And if you're interested in learning more about improving animal welfare in veterinary practice, then there's a new BSAVA manual of practical veterinary welfare that's due to come out as well. And don't forget the details. There's lots of little things we can do in a euthanasia situation to make that process easier for the animal and the owner. As I've said, communication is really important. Make sure the owner's clear on what's going to happen. Make sure you introduce yourself. Make sure they know your name. Those little details are really important. Make sure you've got a comfortable, quiet environment, that there's a bed for the pet, a chair for the owner, and tissues handy. Have treats or food available to give to the animal. Make it as pleasant an experience as possible. Make sure phones are muted and the radio's off. There's nothing worse than an inappropriate song coming on the radio at that crucial moment. Schedule them at the end of the day if possible, and you can use things like candles, as you can see in this photograph, with a little message just to keep the waiting area quiet, to make sure that other staff in the building know that there's a euthanasia going on. I think one of the things that's really important for me is that the owner has access to the patient and the patient has access to their owner. They're the most important source of comfort. So I really like using either the medial or the lateral saphenous veins are my preferred veins of choice for euthanasia. And you can see those in the photograph. They're really accessible. They're really nice. You get a cannula in there, attach a long line to it, attach a drip line to it. You can sit, 3 feet away, 4 feet away. The owner's with their pet. They've got full access to the head. They're not, vying shoulder to shoulder with someone who's raising a cephalic vein. It's a nice, calm way of them being able to say goodbye to their pet and you not intruding in that moment. And that's absolutely how I prefer to do all of my euthanasias. It's also been really helpful for social distancing during the pandemic. And if it goes wrong, don't panic. Make sure you've got your backup plan. Make sure you've thought through what you might do next and how you might deal with a situation if you can't get the vein, if the animal is stressed, think about sedation, all of those things. Allow the owner to spend time with their pet afterwards and reassure them. And I do like to affirm their decision making and reassure them that they've made the right choice. I think that's important. Reflect on what aspects of euthanasia make you uncomfortable. I think always thinking about why we're doing what we're doing, what things make us uncomfortable. Are we uncomfortable with convenience euthanasia? If not, why not? What are we comfortable with in terms of euthanasia context? Are we comfortable with animals suffering before we make that decision? And talk about it, share your experiences. What do you think works well? What doesn't work well? What do you think is acceptable? What do you think is not acceptable? I think it's really important to have a shared consensus around euthanasia decision making. And share tips and tricks. So my standard technique has now become our practice standard because of social distancing during COVID. And I hope that it will continue to be so even once the pandemic's over. But those little tips and tricks that can improve that euthanasia experience, I think, are really important. So I would like to hear yours. Thank you very much for your attention.
Thank you so much, Heather. What a wonderful presentation. Such an important issue. We've got some questions that have come in. I have some questions as well. I'm aware of the time, so we'll just go through these quickly. The first is, do you have any thoughts on how we better align as a profession, given the vast differences in opinions on pain and welfare, etc., between vets?
Oh, that's such a massive question. I'm not sure I can do it justice. I think education is key. I think making sure we have a good evidence basis, especially around things like pain. There's so much evidence now. I don't really think that there's an excuse for us not to be managing pain, and particularly chronic and degenerative pain. Management of those things are really important. But also recognizing when we can't manage pain and when we need to start thinking about other options, including euthanasia, I think is really important. Having those conversations early with colleagues and clients, particularly if they're an animal that's well bonded to the practice and everyone loves it and all the nurses love the animal, they know the client, all that kind of stuff, I think makes that decision making harder. But starting to drip feed it early, not in a, I think we should schedule a euthanasia, but in a sort of, we need to start thinking about his quality of life. Is there anything else we can try? Being proactive about managing pain and that transition into euthanasia decision making, I think, rather than avoiding it.
And what about just another one that's an interesting question. What do you think about the presence of children at euthanasia?
I think it depends on the child. I've had children at euthanasias, and I think children are often really robust, actually, and it can be, for the right child in the right situation, if it's well managed, I think it can be a healthy experience for them to say goodbye to their animal. I actually had a child in a euthanasia just a couple of weeks ago, and he said to me, "So is Fluffy going to die now?" And I sort of took me back a little bit because he was very blunt about it. And I said, yes, Fluffy's going to be dead. Once I give him this injection, he will be dead. And that probably sounds very blunt, but I think it's really important that we are straightforward in our communication around euthanasia decision making. I have heard situations where vets have talked about putting an animal to sleep, and the owners have misunderstood that and thought that it might be going for an anaesthetic. And that is a terrible misunderstanding to try and correct. So, like I said, I think that communication, and sometimes being a little bit blunt with the communication, is actually really important.
Yeah, excellent. Well, thank you so much, Heather. Your talk was fantastic. We've got some other questions, but what we'll do, just in the interest of time, is we'll give them to you and we'll answer them as per we discussed yesterday, and we'll put those questions and answers up. I also just forgot to mention that Heather's charity of choice is Animals Asia, to end cruelty and restore respect for all animals through Asia. So great charity choice. Nio chose that yesterday as well, so really pleased to see that. So thank you again.